Hello everyone, I'm Dr. Sivarajan Thandeswaran, stroke and neurovascular consultant at Kauvery Hospital, Chennai. So today I'll talk on two topics. First is what to do when you notice someone is having a stroke, and the next topic will be on stroke-ready hospital. So if you see someone having a stroke, obviously you would notice they are having a focal neurological deficit like sudden droopiness in the face, weakness on one half of the body, or they are having difficulty talking, or maybe having imbalance. The first thing is not to panic. Make sure they are in a safe place. Maybe you could make them sit down or lie on bed. And if possible, if you have a kit to check sugars at home, you could do it because low sugar is the commonest mimic for a stroke. And if you could check pulse, blood pressure, and so on, it's well and good. But the first and foremost is time. Time is brain. So you should immediately think of coming to a stroke ready hospital. And the best way to come to hospital is by an ambulance. It's okay if you can't get an ambulance and you could come in a car, but the problem is if somebody has heavy weakness, by the time you manually get them down into a transport mode, you may be actually causing more injury. So if possible, come by an ambulance. What is stroke ready hospital? Stroke ready hospitals are ones who have a proper guideline and protocol in place, who would receive patients promptly and assess in a time efficient manner and start treatments immediately. The international standard is that a person with a stroke should have a door to needle time of less than 40 minutes. The meaning, we should finish the scan and start treatment within 40 minutes of arrival in the front door. And luckily at Kauvery, we deliver the hyperacute treatment within 20 minutes of arrival. In some scenarios, we have even delivered the treatment within 10 minutes of arrival. So as soon as the patient arrives, the patient should be received by a team well equipped with stroke members like a physician, emergency nurses, intensivist, if necessary, a neurointerventional radiologist, and so on. So no time should be wasted. Each and every passing minute means there are a lot of thousands of neurons that are lost in the brain. So we would take you immediately to the CT or MRI room, do a scan to identify the type of stroke, and if it is a blockade in your artery and if there are no contraindications, we would deliver the clot buster. If the clot is longer, we would transfer immediately to a cath lab where we may be able to take the clot out immediately using a mechanical device. In some scenarios, it may be a bleed. If that is the case, we would involve the neurosurgeon who would have been pre-alerted by the stroke team by the time the patient is in the scanner itself. So by this way, we can minimize the brain damage and get the best outcome for stroke patients. Thank you.